Good morning. You're listening to KILJ, and it's time for our Henry County Health Center FYI. This morning we have the emergency department with us, specifically Casey Mangold, the emergency department manager, and Lacey Clark, who's the director of inpatient and emergency services. Good morning.
Good morning.
Good morning.
Whoever wants to go first, someone jump in and introduce yourself. Tell us how long you've been at the Henry County Health Center Emergency Department, maybe some information on your backgrounds in healthcare.
All right, my name's Casey Mangold. I've been with Henry County Health Center since 2014. I've worked in healthcare off and on since high school, but have been consistently in healthcare since 2011. I worked at a CNA at Great River Medical Center and an ED tech at Mercy in Iowa City during nursing school. I graduated from St. Ambrose University and have been at HCHC ever since.
I've also been at HCHC since 2014. I graduated in 2012 from Indian Hills with my RN degree. I worked at another facility on med-surg and then came here to work. I've worked in the ED here and the inpatient floor, and then as a house supervisor before I took over as the director of inpatient services. And then I also obtained my bachelor's degree in 2019.
Awesome. Well, it sounds like we have some highly qualified people in the emergency department here at the Henry County Health Center, and glad to have you on KILJ to talk about that. So does somebody want to talk about the range of services that the emergency department provides?
So Henry County Health Center Emergency Department has 24-hour lab and radiology coverage. We're also a level 4 trauma center, and so that means that we must meet statewide standards to consider to be trauma ready. The ER also has highly skilled nurses and physicians that know how to act quickly and appropriately when any condition arises, from heart attacks to strokes to something more simple than that. But pretty wide variety of services. We don't have everything available all the time, but we can get you to the right place, and we know how to keep you stable for that transfer.
So what can someone expect as a patient when they come to the Henry County Health Center Emergency Department?
Most of the time, people can appreciate a really short waiting period. Our goal is to get patients in a room seen by a nurse within 10 minutes, and typically we can accommodate that. We have doctors that are on staff 24/7. They make sure they want to get patients feeling better as soon as possible. We also have really high patient satisfaction scores here. Some of them have been the highest we've seen in a long period of time. So the team here, the nurses, the aides, the doctors, everybody is really patient-centered, and they always go above and beyond for the patients here.
Explain a little bit why having a local emergency department is so important for people who live in Henry County.
Yeah, it's very important to have the emergency medical system, the EMS, and the emergency department available in such a small community is huge. When you're in the time of need, it's nice to be able to count on somebody local, especially if it's, just getting the ambulance to you or just having a quick drive so you can get medical care right away. It's also a huge relief to those that know that their hometown and home community folks that are the ones that are taking care of them. Without Henry County Health Center, you're looking at longer commutes to get medical care that was previously available, and that trip becomes even more difficult when you're relying on EMS to transport you due to lack of transportation, and then that's going to pull EMS out of the county. Then that could delay our 911 response times as well. Additionally, HCHC ED prides itself, and we hear it about every day, that people come out of their way to come here for the care, they almost always prefer to stay here as well. So not just the convenience, but the care that we provide really sets us apart.
Let's talk a little bit about that. I know that the emergency department has doctors specifically dedicated to treating patients 24/7 who come to the emergency room. Can you give some information on those emergency department physicians?
Yeah, so we have three main providers that work here. Dr. Frank, he's also our medical director. He's been here at Henry County Health Center on and off since in the 90s, actually. But he's been in his current position as ED provider and that medical director for the past 5 years. He's highly competent, very involved in making sure HCHC and the ED are able to provide optimal care to patients. And he's a fantastic educator for staff. He's great. Our second, one of our other providers, Dr. Grekoff, he's also a fantastic physician. He always puts patient first, often goes above and beyond the requirements, and he always ensures that patients get proper follow-up. He takes the time to ensure that they understand and they're comfortable with that follow-up and the post-visit process. So, and then Dr. Shabillion, she's one of our other providers. Again, she's a great asset to our team. You know, her patients speak very highly of her as well. She's very personable with people, very detail-oriented, and just like Dr. Grekoff and Dr. Frank, again, provides very patient-centered care. So overall, we have a super great group of physicians. We're very lucky to have kind of our core people here. And again, they are dedicated to just taking care of patients in the emergency department.
When should people come to the emergency department? What's the difference between maybe an emergency versus urgent care?
So the simple answer is if you feel like you have an emergency, you should come to the ER, and you should come to the Henry County Health Center ER. Our staff's unable to give out any advice, so don't necessarily need to call ahead. We can't answer whether you should or should not come to the ER, but we could refer you to your provider or another way to get that answer. And there's no perfect answer. Each situation is truly different. In general, chest pains, trouble breathing, lacerations that require repair like stitching, stroke symptoms, major orthopedic injuries, motor vehicle accidents, things like that would need to be seen by an ED and wouldn't be appropriate for an urgent care. In general, mild coughs, colds, mild fevers. If you're just looking for a work note or mild orthopedic injuries that probably just needs a sling or something, that could be easily handled at an urgent care or primary care setting. But with that being said, if you're not sure or just want to get answers quick, we're happy to see you at Henry County Health Center ER. We have access to additional resources that aren't available in urgent cares and the primary care settings, and we'll be happy to see you and get you in a timely manner.
Some patients might be hesitant to come in. They're not sure if their symptoms qualify as an emergency or not. What would you say to those people?
So at Henry County Health Center ER, we'd be glad to see you if you have any condition, big or small. With a few caveats, there's a few things that we cannot offer, and just wanted to clear that up. We can't do an emergent MRI, so if you've been meaning to go in and get an MRI of your shoulder or something, you're worried about your rotator cuff, we wouldn't be able to accommodate that. And we have only have ultrasound available Monday through Friday, 8 to 4 most days. So if you're looking for an ultrasound, it might not be available. But regardless, if we have that available or not, we'll be happy to see you, evaluate you, and make sure there's nothing we can do to help you in the meantime.
And even if you feel like if you're hesitant about it, you know, you think, I don't know if I should go to the ER, even if we can just check you out and give you that reassurance that, yeah, you know, everything is fine, but sometimes something that you feel like could be such a small thing can be actually a really serious health problem.
Yeah, absolutely. That's such a good point. Last question for you guys. What should patients expect at Henry County Health Center's emergency department when they arrive?
So, I mean, typically when you come into the ER, you're going to be greeted by the registration desk, excuse me. And then there's a triage nurse, or we have the ED nurses, obviously, are going to come out. They're going to get you triaged. try and get you seen as quick as possible, figure out what's going on with you. You know, they're going to ask you about your medicine, how long it's been going on, and then they're going to report off to the ED providers, let them know, you know, typically us nurses, we have that kind of sense of, you know, that, hey, they look okay, but I think this is a pretty urgent issue, and tell the providers that so they can get seen as quick as possible. And then, you know, of course, you're going to, depending on what's going on, you might get some labs, some x-rays, but the nurses, the providers are going to keep you up to date on the plan of care. They're going to let you know the results of those while you're there, and make sure that everything is okay and they can safely send you home or find an alternative place, such as, you know, being transferred or being admitted to the floor up here, whatever. So, you know, the staff they always call within a day or two to follow up with the patients, make sure there's no questions. If there's anything more that they can do or refer them somewhere, they'll do that. So typically, though, you're going to come into a great group of doctors and some amazing nurses down there. So.
Awesome. Well, we've been talking with Casey Mangold, Emergency Department Manager, and Lacey Clark, the Director of Inpatient and Emergency Services, right here at the Emergency Department at the Henry County Health Center. Thank you so much.
Thank you.
Thanks, Katie.